Hello, Des here. I'd like to take 5 minutes or so of your time to walk you through what's required post-migration of your account into our new platform to ensure your record's 100% complete. The new platform has been redesigned from the ground up to go above and beyond of just the study of the COVID-19 vaccinations. We're building an analytical solution with dashboards, charts, tables, so you will have complete transparency into the safety and effectiveness of any and all medical interventions. The new platform will be open to all, regardless of vaccination status. I hope that together, as part of the control group, we can provide a solution to rebuild trust in our medical establishment and to reassert our rights as individuals and seek accountability and reform where needed. Thank you for helping shape our future. Okay, so let's have a look at what's different in the new platform. And like I said already, it's been redesigned from the ground up so we can achieve this aim of having this open source health informatics solution. In order to achieve this, we've had to implement a much stricter categorization of data, and we've expanded the amount of information that we're collecting with all of the data points, such as vaccinations, health conditions, allergies, etc. And we've added extra functionality to look at pregnancy and fertility in more detail. Additionally, we're looking at linking the ailments and medications together so we know which treatments you're taking for which health conditions, and so we can really understand the cause and effect, see which treatments are successful and which aren't, and it will give us the ability to compare the approaches between the sort of alternative solutions and the allopathic approaches. And also the whole interface has been redesigned to make it a lot easier for you to work with and hopefully a lot faster as well. Okay, so what do we need your help with post-migration? Well, firstly, we're going to need your help to go back and relook at the data that you've entered already and to populate some of the new fields that have been added, some of the new data points. This includes such as adding severity to the health conditions. So we know, whether it's a serious health condition, life-threatening, or whether it's something that's just a mild condition. Additionally, we're going to need you to go through an exceptions log to review data that we're unable to load automatically into your account for you. And the goal is to take your account from, wherever your starting point is, through to 100% complete. And there's prompts along the way to help you do that. Okay, so we've broken this down into 3 steps to get your account up to date. Firstly, just log into the new platform. You can do this through our website. Once you're in there, the first step you'll be asked to do is to confirm the account settings, and we'll show you that in detail shortly. And then from then onwards, you'll need to update each participant record that you have within your account. And then finally, as an optional step, if you wish, is to create your health cards. Okay, so the first time you log into your migrated account, you'll be asked to confirm your location. This will either be populated from your legacy system or you'll need to enter the information yourself. You can click on the flag. You should see your country here unless you're using a VPN. And then once you've chosen your country, we're asking you to put your nearest, largest major city or town. And then also select whether you're living sort of in the city, on the suburbs, or in a rural location. Your email preference will be carried forward from the legacy system, and you can update those if you wish. And then finally, click on the option to consent to having your data included within our analysis solution we're building. When all that's done, click the Save option at the bottom, and then you'll be taken through to your account dashboard. So from now on, whenever you log into your account, you'll be taken through to the account dashboard. And here's where you manage every participant you have within your account. You can see the status of each participant. So here you can see that this record is 50% complete. And in order to update the participant record, I click on the link here to review my data. So once you access the participant record, you'll be able to see at the top of the page the current status of that record, and you'll see this updated as you go through editing the contents. At the top here, you can see the different sections within the record, and you'll be able to click on each of these to jump to those particular sections. First of all, we'd like you to go and have a look at health conditions. And as you're looking at health conditions, you can see each of the rows will have a flag in them. we want you to click on the flag or click on the blue edit button so that you can access that record and update the new data points that were not in the legacy system. Okay, so I clicked on the edit option and now I've opened up the health condition. When you're editing a health condition or any other section, please pay careful attention to the items marked as please verify or the red asterisk. These are mandatory sections, so you need to put a value in here. Sometimes you'll be able to choose unknown or private, but in most cases, to make the record as useful as possible, put the value in there that's correct. In some cases, like in the case here of severity, we've applied a default value as part of the migration because we didn't ask severity before, and just use the drop-down options to select the correct level of severity for the health condition. Also, below that, you can see an option to be able to attribute this health condition to some sort of medical intervention. So if that is the case, you'll be able to say it was a medication, surgery, or vaccination in this case. And when you do, if I click vaccination, for instance, I'll then be provided with another option which will ask me which of the vaccinations logged within my record do I want to attribute to as the cause for this health condition. If you can't see the vaccination in here, or it's not added into the system as yet, you'll be able to go and add those and come back and edit this record at any time. So once you're done, click save, and then you can move on and edit the next condition. Once you've updated all your health conditions, scroll down your record and look for the flags as you did with health conditions and update each of these items in turn. This will apply to allergies, treatments, etc. Also, look out for some sections of the data where you'll see flags actually in the item detail as well. Anytime you see the flag or the required option, you'll be able to click on that or click the edit button to go through and update that particular item. Once you've been through your entire participant record and you're happy that everything's updated, we'd like to scroll back to the top of the record and look for the box with the orange dots around it. This will only appear if you have exceptions that need to be added into your account. And here you can see this is the legacy record, and I need to decide how I'm going to deal with this for my account. This was not automatically migrated. So I can click on the Add As button and then select which category I'd like to add that to, select the category, and then I'll be able to edit the details when I get there. If I find that this data is already in the system and I want to delete it, then I just click on the delete button, the trash can. Some of this data may be erroneous, may have been misentered, or it may be duplicates. In the case of this allergy here, you can see I put 3 entries in one. So in this case, I'm probably going to do this add 3 times to add each of these allergies in. Finally, after having updated all of the individual items, I'll scroll to the top of the page. I can see that my overall completeness has updated, and now I need to add information to any sections which are the new data that wasn't captured in the legacy system. You can see the flashing red prompts that tell you where the data is missing. Simply click on the flashing prompt to go through and add this information. In some cases, like in this instance with COVID test, you can see I've got an option here to say I've never tested before. So if we haven't actually ever had a COVID test, just click on this option. This will remove the prompt and it will update your score. The 2 sections that won't impact your score are the emergency contacts and the emergency information, as this is optional information that you can enter for use with your health card. This information will be displayed when somebody scans the QR code on your health card. The idea being pretty straightforward. It's instructing someone as to which contacts they need to get in touch with if you are found in an emergency. And also the emergency information is any advanced decisions you want to make anybody attending you aware of, such as your wish not to consent to any COVID-19 vaccinations or tests in this example. To create your health card, return to the account dashboard, and then under each of your participants, you'll see the option here to create health card. Simply click on that, It'll take you to a screen where you'll be able to choose the name and the language for your health card, and you'll be able to create a health card for each of your participants. Ordering the health cards is done separately. At this stage, these are just digital cards. So in order to choose what information will appear on the scanned page for your health card, you need to return to the participant record, and there you'll be able to see the options to show or hide each item on your health card. You do so simply by clicking on the item on the card icon as shown against each item. Green means that it will be included on the health card, and grey means that it will be hidden from your health card. Subscribing associates will be able to order printed durable copies of their health cards free of charge. You can see if you're an associate member at the top of the page here, and if you scroll down to print order cards, you'll see the button here to order the printed cards. Here you'll see a list of all the cards within your account, and you'll be able to select which cards, and you'll see which ones you're ordering with the big tick, enter your delivery address, and then you'll be able to order the cards. There is a small fee for postage and packing, and you'll see the details in here, depending on where the cards are being shipped to and how many cards you're ordering. So hopefully that should give you enough information to have a stab at updating your participant record. If you get stuck or need help at any time, feel free to reach out to our support team. Other things that you may find within your record now, which are new, are the participant certificates, which you'll be able to access via the resources section. And also we have a new buddy system, which will enable you to choose somebody else that we would notify if we haven't heard from you for a long time. And this is so we can make sure that nothing's happened to you. Also, there's some new features coming in the not too distant future. We have a death notification letter for your personal effects. Further enhancements to your record, we're going to have a PDF download, so you'll be able to have a hard copy of your health record, and also the ability for you to share your health records with other people that you choose, such as alternative medical practitioners. And finally, obviously, we've got the analytical solution that we're building that will give you access to statistics and a knowledge base and the analytical dashboards that we discussed. So finally, that just leaves me to give you a big thank you and say how much we appreciate you all being part of the solution, enabling us to take back control of our health. Thanks again, and thank you for your time.